On February 27th, famous actor and activist Gary Sinise announced that his son Mac had passed away from chordoma, which is a very rare spinal tumor. And before we start, our hearts go out to Mr. Sinise and his family, and our prayers go out to Mr. Sinise and his family and to his son Mac. In regards to the topic of chordomas, these are malignant tumors that are extremely rare. They follow the human notochord, which is the embryonic portion of the human fetus that makes the spine. And these usually don't appear until patients are over 50, maybe 40. When I was in my residency, the professor of our department was a world's expert in chordomas, in spinal tumors and musculoskeletal tumors. So we did see a number of chordomas, and what I can say is that none of them had a happy ending. Most of them appear in the sacrum or the tailbone area, low back, and others at the top of the cervical spine in the skull. And they can be seen in other areas, but they're usually directly in the midline of the body. They're very, very slow growing. They could be there for many, many years until they start to cause pain or maybe some form of bladder incontinence or headaches, some atypical symptom that shows up. And then many times the diagnosis is not made for years. And these are usually these are malignant. They can be metastatic. They're primarily more in males than females, 3-to-1 male dominance. And 50% of them occur in the sacrum and coccyx, which is the tailbone area, and about 30% of them in the base of the skull. It's thought to be that the notochord cells undergo some form of malignant transformation and turn into a cancer, which is very insidious and very, very aggressive. Many of these patients will show up with headaches, pain in their head, pain in their neck, pain in their low back, problems with their bladder or bowel. And like I said, they are rare. Some of them are noted actually because they're in the low back on a rectal exam. There'll be a mass that's found. It's often difficult to see them on a plain x-ray, so you need a CAT scan or an MRI to see them. And they're usually biopsied first, and then taking care of them usually means a very wide resection surgically, particularly in the sacrum and the coccyx, in which some nerve roots have to be sacrificed. So it's a very disabling disease. Radiation treatment usually follows any type of operation. Many of these are inoperable, meaning surgery won't help. And the ones that I've seen have all been rather sad outcomes leading to death. They metastasize usually late and can go to the lungs or sometimes to the bone, but maybe sometimes also in the midline. You see Mr. Sinise's son had metastases to his face. So anyway, it's a very rare tumor, and it's not a good diagnosis, that's for certain. And once again, our hearts and prayers go out to Mr. Sinise and his family.